class. Let's get started. Have a seat now. Today we're going to talk about breast cancer. Could someone please be my slide clicker, please? Thank you, Cora. First off, does anyone know the definition of breast cancer? Anyone? Come on now, don't make me pull a tongue blade. Oh, come on. Someone who hasn't volunteered before? Okay, Jamie, go ahead.
It's a malignant tumor that starts in the cells of a breast. A malignant tumor is a group of cancer cells that can grow into surrounding tissues or spread into distant areas of the body. The disease occurs almost entirely in women, but men can get it too.
Good, Jamie, good. It's a cancer that forms in the cells of the breast after skin cancer. Breast cancer is the most common cancer diagnosed in women, and it can start in any part of the breast as invasive lobular carcinoma, ILC, developing in the lobules, which is the milk-producing glands, or invasive ductal carcinoma, IDC, developing in the ducts, which is tiny tubes that carry the milk from the lobules to the nipple. Next, Cora. When it comes to causes, we do not know the main cause of most breast cancers. Theories say it is most likely caused by changes in the genetic material in our cells, which correlates to our lifestyle, but some can be due to risk factors that can't be changed, with an exception of some such as age. 80% of breast cancers are found in women over the age of 50. A family history of breast cancer in mothers or sisters carrying the BRCA1 and BRCA2 genes, which are human genes that produce tumor suppressor proteins. A history of abnormal breast biopsies, or a history of breast cancer in general. You guys don't need to write all this down. Just listen to what I'm saying, okay? Don't write it all down. I'll let you know what you need to know, okay? Having your first menstrual period before the age of 12, as well as going into menopause after the age of 55, having no children at all, or having your first child after the age of 30 can cause this cancer. Daily alcohol consumption of 2 drinks or more, obesity and a high-fat diet, physical activity more active the lower the risk, race, which is a higher risk in white women than African American women, breast exposure to radiation, so having radiation for another cancer throughout your body can cause breast cancer. Dense breast tissues as seen as on a mammogram. Physical activity, meaning the more active, the lower the risk. And postmenopausal hormone replacement therapy, HRT, with a combination of estrogen and progesterone drug. So the longer a woman uses HRT, the more her risk increases, okay? Any questions?
How could you develop breast cancer by having no kids?
You know what? I'm not really sure. That would be a good question to look up. Yeah, look that up, then let me know. Okay, next slide, please. Signs and symptoms. Okay, so the main sign is a lump in the breast. You should regularly feel lumps in your breast, ladies. Do you do this often? It is really important to occasionally feel around your breast for lumps, and if you feel anything, you should go to the doctor immediately, but not all lumps are cancerous. But just go to make sure, okay? Boys, you should check your breast tissue as well. No, I'm serious, Kevin and Sal. You need to do this, it's very important. You need to do this, it's very important, I'm not kidding. Anyways, a change in the appearance of your breast, such as any unexplained change in the size or shape, swelling or shrinkage, or skin of the breast becomes scaly, red, or swollen. Any nipple discharge, clear or bloody. If women are breastfeeding, milky discharge is normal, but if you have any of the other symptoms above, you still need to be checked by a professional. All of these are very important to focus on, because if you have any small sign, you really should make an appointment for a mammogram screening or an MRI so they can take an x-ray or picture and look further into your breast, okay? Okay, next slide. Treatments. So there are many treatments to have done, and they are coming out with many different techniques and are doing various trials, but the most common treatments are biopsy to remove the whole breast tissue, which can be pretty invasive to some individuals, radiation therapy to try kill off all the forming breast cancer cells by using X-rays or similar forms of intense energy. Chemotherapy, again, to try to kill off the forming cancer cells using chemicals that have specific toxic effects upon the disease-producing microorganisms, which in this case is breast cancer cells. Hormone therapy, which will treat the disease or symptoms with synthetic or naturally derived hormones, which comes from the use of medications containing both estrogen and progesterone to increase diminished levels in the body. Targeted therapy that uses drugs or other substances to identify and attack specific cancer cells with less harm to normal cells. Some therapies block the action of certain enzymes, proteins, or other molecules involved in the growth and spread of cancer cells. And last, bone-directed therapy is when cancer spreads to the bones, which can cause pain and bone breaking like fractures and other problems. This therapy is a specific bone strengthening drug that can lower the risk of these problems. Alright, do you guys need a break? You look like you can use a break. How about we go take a break, be back here 1:45, okay?
A few moments later.
Alright, class, you guys should be in your seats already. I want you in your seats before the break is over, okay? Hurry up, get in your seats. I'm tired, I need to sit down. Okay, here is your role as a CNA. Your responsibilities when taking care of a patient with breast cancer is complex. You are responsible for observing, documenting, and reporting any of and all changes that we observe in the patients or residents, okay? This not only includes physical appearance changes that the patient may be going through, but any signs of emotional distress as well. Remember, not only is a person with breast cancer dealing with the physical aspect of the situation, he or she is also dealing with the social, spiritual, emotional, and family impact as well. Okay? Be understanding and empathetic. Listen when the patient wants to talk, and if you feel that there may be issues with the patient contemplating suicide or any other psychiatric issue, report it to your nurse immediately. Above all else, practices the golden rule, do unto others as you would have them do unto you. Okay, so that is it for today, and is everything you really need to know in order to help someone with breast cancer. We have about 10 more minutes. Does anyone have any stories they want to share relating to breast cancer? Yes, Stacy, go ahead.
My mom, when she was 35 years old, was diagnosed with breast cancer 3 times. In addition to having breast cancer 3 times, she was also diagnosed with ovarian cancer. My mom went through multiple rounds of chemotherapy and radiation. During this process, all her hair fell out, and she was very, very, very ill and very weak. I remember her just staying in bed most of the time when I was younger. In addition to her chemotherapy and radiation treatments, my mom chose a more holistic approach when treating her symptoms of radiation and chemotherapy. When she felt a little bit better, my mom went to multiple health retreat camps. At these camps, they did yoga, a lot of meditation. Their diets were restricted to only juice cleanses. While at these retreats, my mom said that she was able to ground herself and have a more stress-free environment while trying to heal. Most of these camps had on-site doctors and nurses, in addition to yogis, meditation guides, and physical therapists. In addition to traditional treatments, patients with breast cancer may choose an alternative, more holistic approach. The goal of a holistic approach is to balance the whole person, physically, mentally, and emotionally, all while conventional medicine does its work. For many people diagnosed with breast cancer, a holistic approach has helped to relieve symptoms, ease treatment side effects, and improve the quality of life. A few types of holistic options are acupuncture, aromatherapy, chiropractic therapy, guided imagery, hypnosis, journaling, massage, meditation, music therapy, progressive muscle relaxation, Reiki, which is a focus on energy balancing, shiatsu, spirituality and prayer, support groups, tai chi, and even yoga. The roles of a CNA when caring for a resident or patient with breast cancer are very similar to the care of anyone. As always, focus on the principles of care. The principles of care are communication, independence, infection control, privacy, safety, and dignity. In addition to those, provide comfort, answer call lights, take and record vitals, collect samples, sterilize and clean rooms. Okay, ready? I'm gonna start reading it. Wait.
Okay. Yeah.
Okay. Yeah, it's a malignant tumor. Wait, sorry, I had to start again. I don't know if I can do this. The disease occurs almost entirely in women.
Oh, she's laughing. It's funny. Did you see it? How does it look?
Is this on still or do it
Yeah,
just
it's,
press?
just record, it's still recording.
Oh, is
Does
it?
it say record?
Never.
Come on, Sally.
She's focusing it. Just your teeth. No, I'm just kidding.
Edit. Oh, that's a naked one.
What?
I just see a naked hand come up on.
Oh, sorry.
Next, Nora. I mean, Cora.
Who's Nora?